Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. This video is the part 2 of the ulcers due to frostbite, and I am here to continue the conversation from where we left off. We are going to talk about the complications, the management, and then the prevention. When it comes to the complications, you're going to have tissue death in these areas, what we also call gangrene or necrosis. You're also going to have infection setting in, because remember, if you have a cut-off of blood supply, you will not have a recruitment of the cells of the immune system, and then you end up with an infection in these areas. You also end up with hypothermia because you have been exposed to the freezing temperatures. The other thing that can happen is that you'll have persistence of symptoms. For example, persistent pain in these areas, numbness in these areas, stiffening in these areas, and these symptoms can go on for life or for a longer time. When it comes to treatment, treatment is done in 3 phases. We do home care, what we also call the self-care. We do medical management, also surgical management. When it comes to the home care, I recommend that you extract yourself and separate yourself from the freezing temperatures, the areas that are freezing. Because if you do not do that, you're going to cause further damage to this area. Also remove any items from the affected area. Remove rings, boots, shoes, ankle braces from the areas that have been affected. Please also change your dressings, change your clothing into warm, dry dressings. And also make sure that you take a warm shower before that. We recommend the water should be between the temperatures of 37 to 39. And after that, you cover yourself nicely in a warm blanket. But also the affected areas should be rewarmed. And the rewarming is usually done in a bath or in a basin, where the water is between the temperatures of 37 to 39. And it should be done at least 30 minutes until the places look reddish and soft and movable. Do this twice daily and continue until you're seeing signs of healing. For example, you're seeing new tissue growth, you're seeing new skin growth under the affected areas. And of course, the signs and symptoms are also receding. The other thing that I really want to emphasize is the rewarming part. When you're rewarming, please do not re-expose yourself to the coldness, because it will cause further damage. For example, you're at work, wait and get home to rewarm so that you don't re-expose yourself on your way from work to home, as it will cause more damage. When it comes to home care, please don't walk on these affected areas. For example, it is your foot. Avoid rubbing these areas, avoid massaging the areas, and of course avoid re-exposing. And after every session of rewarming, please make sure that the areas are covered in clean bandages, and the feet or the hands should be separated. They shouldn't be connected to one another. They should be separated, and they should be dry and clean. Medical management entails using antibiotics, using painkillers like amitriptyline. We also employ Eloprost. It helps to widen your blood vessels. We also use thrombolytic therapy, where we use medications to break down the clots within your blood vessels. So that is about the medical management. Surgical management entails debridement, disarticulation, and also amputation. And these surgical managements are actually done after some time, after a long time, because we want to give a chance to these tissues to take and heal and recover. Because sometimes the dead tissues, the tissues that look dead, might actually be just recovering tissues. So we give them time before we debride, articulate, before we amputate that part that has been affected. When it comes to the prevention, we usually advise that you protect your body when you're out there. Please make sure that you're wearing loosely fitting clothes in layers. For example, put on a nicely loosely fitting cloth and put on a coat, a trench coat. You can use a hat that is waterproof. to cover your head and also your ears. You can put a scarf on around your neck. You can dress in mittens. Mittens are better than gloves when it comes to protection. You can also use boots, loosely fitting boots, and also loosely fitting warm socks when it comes to dressing. Please avoid the coldness as much as possible. Please also, when you're maybe jogging or running or walking around, please always tell people where you're going and what time you're going to come back. And always take a phone with you and a power bank, such that when you get any emergencies, you are able to connect with your people to come and help you. When you're going out there for maybe a ride when it is snowing, please make sure that you take a suitcase with you that has blankets, warm blankets, and warm clothes, such that when you get stranded in any way on the road, you're taken care of by these clothing. Please avoid smoking, avoid use of drugs, avoid using of alcohol. Speaking of using of drugs and alcohol, if you're out there and you're struggling with alcohol abuse, drug abuse, I am sending you my love to you, and I hope that you get the help that you need so that you can get on the other side of the journey. So thank you so much for those of you that have shared my videos. Thank you so much for liking my videos. Please continue liking my videos, subscribing to my videos, and thank you for giving me part of your time to listen to me. And I'll see you in my next video. Bye.